Welcome to today's video lecture on rheumatoid arthritis, RA, a chronic autoimmune disease that primarily affects the joints. In this comprehensive lecture, we will discuss the causes, symptoms, diagnosis, and management strategies for rheumatoid arthritis. Let's dive in. Rheumatoid arthritis is a chronic inflammatory disorder that primarily affects the joints, causing pain, swelling, and stiffness. It is an autoimmune disease, which means the body's immune system mistakenly attacks its own tissues, particularly the synovial lining of the joints. Unlike osteoarthritis, which is primarily caused by wear and tear on the joints, rheumatoid arthritis is an autoimmune condition where the body's immune system mistakenly attacks its own healthy tissues, including the joints. The exact cause of rheumatoid arthritis, RA, is unknown. However, it is believed to result from a combination of genetic, environmental, and immunological factors. Here are some potential causes and contributing factors that have been identified. Genetic factors. There is evidence to suggest that certain genetic factors increase the risk of developing rheumatoid arthritis. Specific genetic markers, such as human leukocyte antigen, HLA, genes, have been associated with increased susceptibility to the disease. However, having these genetic markers does not guarantee the development of RA, indicating that other factors play a role as well. Autoimmune response. Rheumatoid arthritis is classified as an autoimmune disease, meaning the body's immune system mistakenly attacks its own healthy tissues. In RA, the immune system targets the synovium, the lining of the joints, causing inflammation and joint damage. The exact trigger for this abnormal immune response is not fully understood, but it may involve a combination of genetic predisposition and environmental factors. Environmental factors. Various environmental factors have been linked to an increased risk of developing rheumatoid arthritis. These may include exposure to certain infections, such as certain bacteria or viruses, which can trigger an abnormal immune response. Environmental factors like smoking tobacco have also been identified as potential risk factors for developing RA. Hormonal factors. Hormonal factors, particularly in women, may play a role in the development and progression of rheumatoid arthritis. The disease is more common in women than in men, and hormonal changes during pregnancy or after menopause can affect disease activity. However, the precise mechanisms by which hormones influence RA are not fully understood. Recognizing the signs and symptoms of rheumatoid arthritis is crucial for early diagnosis and effective management. Here are some common symptoms to watch out for. Joint pain. Persistent joint pain is a hallmark symptom of RA. The pain is often described as aching, throbbing, or stiffness, and it typically affects multiple joints symmetrically, e.g., both hands, both knees. Joint swelling. Inflammation of the synovial lining leads to joint swelling. Affected joints may appear red and swollen and feel warm to the touch. Morning stiffness. People with RA often experience morning stiffness that lasts for more than 1 hour. Joints may feel stiff and difficult to move upon waking or after prolonged periods of rest. Fatigue. Fatigue is a common symptom of RA, and it can be debilitating. The exact cause of RA-related fatigue is not fully understood, but may be related to inflammation and the body's immune response. Joint deformities. Over time, untreated or poorly controlled RA can lead to joint deformities. The inflammation and destruction of joint tissues can cause joint malalignments, such as swan neck deformity or boutonniere deformity in the fingers. Reduced range of motion. RA can result in a decreased range of motion in affected joints. This limitation can make it challenging to perform activities of daily living and impact quality of life. Systemic symptoms. Rheumatoid arthritis is a systemic disease, meaning it can affect other parts of the body beyond the joints. Individuals with RA may experience systemic symptoms such as fever, weight loss, dry eyes, dry mouth, and nodules under the skin. Symmetrical joint involvement. RA typically affects joints symmetrically, meaning if one joint is affected on one side of the body, the corresponding joint on the other side is likely to be affected as well. Rheumatoid nodules. Some individuals with RA may develop firm, non-tender nodules under the skin. These nodules are often found over pressure points, such as the elbows or fingers. The diagnosis of rheumatoid arthritis is based on a combination of clinical evaluation, medical history, and diagnostic tests. The American College of Rheumatology has established criteria for diagnosing rheumatoid arthritis, which include the presence of joint involvement, duration of symptoms, and laboratory markers such as rheumatoid factor and anticyclic citrullinated peptide, anti-CCP antibodies. Imaging tests, such as X-rays and ultrasounds, may be used to assess joint damage and monitor disease progression. It is important to differentiate rheumatoid arthritis from other forms of arthritis, as the treatment approaches may differ. The management of rheumatoid arthritis aims to relieve symptoms, slow down disease progression, and improve the patient's quality of life. It typically involves a multidisciplinary approach involving rheumatologists, physical therapists, occupational therapists, and other healthcare professionals. The treatment options for rheumatoid arthritis include medications, non-steroidal anti-inflammatory drugs, NSAIDs for pain and inflammation relief, disease-modifying antirheumatic drugs, DMARDs, to slow down the progression of RA, biologic response modifiers, biologics that target specific components of the immune system. Physical therapy, exercises and techniques can help improve joint flexibility, muscle strength, and overall function. Exercises and therapeutic interventions to improve joint mobility, strength, and function. Assistive devices. The use of splints, braces, or other assistive devices can support the joints and alleviate pain. Lifestyle modifications. Managing stress, maintaining a balanced diet, and getting regular exercise can all contribute to managing the disease. Rheumatoid arthritis is a complex autoimmune disease that can significantly impact a person's quality of life. By understanding its pathophysiology, recognizing its clinical presentation, and implementing appropriate management strategies, healthcare professionals can help individuals with rheumatoid arthritis effectively manage their symptoms and maintain joint function. In conclusion, rheumatoid arthritis is a chronic autoimmune disease that affects the joints and can have a significant impact on an individual's quality of life. Recognizing the signs and symptoms, obtaining an early diagnosis, and implementing an appropriate treatment plan is crucial for effectively managing the disease. Remember to consult with your healthcare team for personalized advice and support. Thank you for joining this video lecture on rheumatoid arthritis. I hope you found it informative and gained a better understanding of this complex condition. If you have any questions, feel free to reach out. Stay informed, stay proactive, and take care of your health.